consultant. As you all know, Dr. Rick was brought on at the onset of COVID. We have Dr. Eno Montesir, who heads up our Board of Health as well. Jensen Denoise from my office has joined us as well. And so really, I know Joseph Francois is going to be coming here as well, but you know, really the genesis of this meeting, we've had these in the past. Number one, to say thank you for your leaderships in your church, for your prayers for me and my family as well, and also information sharing. Dr. Herman has been analyzing the data. His dashboard is recognized in the Commonwealth by the Governor's Office. He was the first medical doctor to come up with a daily dashboard. It was so good that DPH, Department of Public Health, replicated it, and they talked to Rick on a regular basis. Dr. Montesir has been phenomenal in terms of leading the Board of Health. Wonderful collaboration with, of course, all the churches and the pastors, but a collaboration as well up at the Shaw Center. Now, we use it as a testing site. As mayor, I spent over $1 million to ramp that up. As you know, we got that reimbursed 100% under the Federal CARES Act money. So we spent the $1 million, we got the money paid back to us, every dollar. And then we utilized that with Brockton Neighborhood Health Center. They did an outdoor testing facility, and then indoors. And then our vaccine led by Eno and the nurses. When I became mayor, we only had one nurse for the whole city of Brockton. Makes no sense. We have 106,000 people. So I was able to get 2 additional full-time nurses. We have a complement of 3 registered nurses that work for the Board of Health. We also have some nurses under our wellness trust team that are consultant. They're getting paid per diem to go out door to door as well, educate and inform. Now, I think there's a misnomer. Some folks believe COVID is gone. COVID is not gone. In fact, just yesterday, someone in my office came down with COVID. What is different than a year ago is that everybody was doing the PCR testing, and Maven, the state's database, would capture the results. And then Eno and his team and Dr. Rick would analyze the Maven results to give us pretty accurate data in Brockton. With everybody doing a lot of at-home testing now, that data is missing. So what Rick is doing every night and Eno is doing is we are reviewing the wastewater in Brockton. It's a daunting task, but it gives us a much better accurate number of where we are in Brockton. With that being said, some of our wastewater comes from neighboring communities. The town of Easton, Stonehill College, we get their waste products as well from their sewer. It's been going on for decades. So again, I wanted to just first of all say that if you need masks, if you need disinfectant, if you need test kits, we have them. We want to continue to do that. At the end of the day, we want to have a healthy city of Brockton, a healthy community, a healthy congregation. We're in much better shape now because of the amount of vaccines. We have over 70% of our population fully vaccinated, but there are some people that came in, rolled up their sleeves, got their shot the first time and never came back. So Dr. Montesir and his team, our Council on Aging, we're reaching out to folks right now saying, hey, you came here to get your first shot, we need you to come back for your second. I've gotten my first booster, I owe myself the second booster. The death count, thank God, is much more manageable now. However, 495 residents have died. Now, prior to that, we exceeded 500, well over 500. Why the numbers came down is that DPH, Department of Public Health, made a change. Originally, it was a 60-day analysis, then it was a 30-day analysis. So if you had COVID within 60 days and you passed away, that was a COVID death, okay? Now it's if you had COVID, if you contracted COVID within 30 days of date of death. So our numbers are a little fluctuating, but I will say this. Everybody around this table has worked to save lives. John Messia has been extraordinary to the point where he was just recognized at Bridgewater State by United Way for his efforts. But it's a team effort. So I really want to thank all of you for what you do every day. I'm going to let Dr. Rick opine and give some more data because I know he has to be somewhere at 1. But again, I just want to say thank you, and we'll just eat and work at the same time. Okay, Dr. Rick.
Let me just echo the thanks of the mayor, and thank you all for those of you who have joined the weekly, now every other week, call with the pastors. I must say it was Maire's idea very, very early on in the pandemic when we were trying to figure out how to spread the word through trusted individuals in the community. And it seemed pretty clear that the citizens were not necessarily listening to the doctors, what they had to say, because the information was changing all the time. At first it was don't wear a mask, then it was wear a mask, then it was masks don't do any good, then only certain kinds of masks do good. So as the science changed, the recommendations changed, and I think that there was an element of who do we trust. But everyone always trusts the pastors. And so it was the mayor's idea to get the group together, spread the information as best we could, describe the science, let people ask questions, and then let you pass the word on to your congregations. And I think that's been a very, very successful part of the experience. Obviously, we all are inventing the wheel. None of us has ever gone through a pandemic before, and so we all had to kind of start at square one and make our way through this as best we could. And I must say, just personally, this has been one of the most, I guess if there is a pleasurable part of the pandemic, it has been dealing with the pastors who always seem so inquisitive, ask the right questions, ask good questions, and have been there throughout the duration. As Mayor said, it's not over, but you know what? It's never going to be over. It's here to stay. I think COVID is here to stay, just like the flu is here to stay. And it may be that we are done with the huge spikes of 700 cases a day. What we're seeing now is a little bit tougher to measure, as the mayor said, because we don't have the tests coming into us. So many people are doing home tests now that we don't really know what the number is. But we do, as Mayor said, measure the wastewater. And so there's no fooling the wastewater, okay? Everybody dumps out everything into the sewage, into Brockton, we measure it. And you can tell based on that, are the cases going up or are they going down? And right now, in all of New England, not just Brockton, but all of the cases are going back down again, which is good news for us. Bad news for other parts of the country, because soon the South and the Midwest and the West, those cases will go up. But for our part of the country right now, the cases are coming down. The death toll as of this morning is 497. So that's a lot of people in a city of 100,000 to die from this disease. But thankfully, we're not seeing as many deaths, and those deaths do again seem to be in the elderly. And so the message right now is, I guess if I had to give a couple messages, one is vaccines still do work, even though people are getting COVID who have been vaccinated, and some people end up in the hospital, not too many, but some people end up in the hospital. They do work at preventing severe illness and death. And so really at this point, they're only effective if you've gotten a booster. Having gotten just the first couple doses of your vaccine doesn't work. You really need to get the booster. And the other thing that people need to know is now that there's a treatment out there. A lot of people are familiar with Tamiflu, which is the pill that you take when you get the flu and it cuts down on your symptoms. Well, there is a medicine called Paxlovid, which is out there, which targets the COVID virus. And it's a pill form. You take it twice a day for 5 days, and as soon as you test positive, if you take this pill, it can prevent you from developing serious illness and death. Not many folks know about it because I don't think we're doing a great job of advertising it, but I've prescribed it several times now, and my own personal experience is folks who have had symptoms today, you take the pill and 24 hours later they don't have the symptoms. That's it, it's gone. And so our Board of Health is doing a good job of contacting folks who have tested positive that we know about, in other words, these PCR tests that are reported to the state, and letting them know about this treatment. But so many people who test positive at home don't know about this treatment, and I just feel like we're missing an opportunity. So there is a medicine out there. It's free. If you don't know anything about it, you can go on a website, and within 15 minutes, you'll be talking to a doctor, finding out if you're eligible for this medicine. And if you are, they will call it into the pharmacy closest to your home. And if you can't get to a pharmacy closest to your home, they will deliver it to your house. And this service is out there free of charge from the state, so we should all know about that. So I'm going to continue to do the daily dashboard at least through the end of this month, and then depending on how the cases are, if the cases do continue to fall, we might switch to a weekly dashboard at some point. We can't keep following this disease forever. It's going to be here forever. And so hopefully we'll be able to switch over to a weekly dashboard. But I do want to, as the mayor said, thank you all for participating, for sharing your knowledge, with your congregations, and look forward to working with you again throughout the course of this.
Thank you, Doctor.
2021, beginning of 2022, I heard of COVID, but early May, I came down with COVID.
Oh my goodness.
And I love my wife so much that I shared it with her. I guess that's the love. But one thing I can tell you, because I have done my homework, because I have thought the truth, and it is said in John chapter 8, verse 32, you shall know the truth, and the truth shall set you free. Believe me, the mayor is also a believer, so he captures what I said. Yes, you shall know the truth, and the truth shall set you free. I got vaccinated, my wife got vaccinated. She's a nurse also, all the way through our boosters, and so therefore we did not have to get hospitalized, and it made the difference in our life because we were vaccinated. We didn't have to go to the hospital or be on ventilators because we did not suffer the severe cases of the symptoms, okay? So which means that we continue to encourage people to be up to date. The term fully vaccinated is kind of obsolete. The current term is up to date with your vaccine. In other words, as often as you hear the news from DPH, from CDC, you get updated up through your boosters. So that means you're up to date. So the city continues to offer vaccines. At the Shaw Center, we're there twice a week. The public health nurses are there on every Tuesday from 2 to 7 p.m. Saturday morning from 7 a.m. to 3 p.m., DPH subsidizes a service through Booster Ambulance, which administers services there, vaccinating people from 7 a.m. to 3 p.m. We also have other sites in the city where we do sporadic vaccination. We go to the high rises and low rises. Also, we realized that there is no standard testing right now because everybody have access to antigen home self-test. However, there are situations where it is required that you have a PCR or standardized test. So that is why the mayor and I meet regularly, and soon we will be having an agency that will be coming to town to do official testing for us. Because for instance, if you're traveling or you go for a medical procedure, they will not rely on their own test kit. You have to have a PCR, which is basically a standardized test. So you'll be able to go to the Shaw Center to get that, hopefully within a week or so. That will be up and running. I did speak with the agency yesterday also, so they're just waiting for our word mayor.
Great.
Also, as the mayor mentioned, we are in the process of bringing in 2 additional staff right now for the Board of Health. They will be epidemiologists. I know it's a technical word, but basically epidemiology is the science that determines the disease outbreak and the determinants, why they happen. So we are going to bring in another epidemiology 1.5 or 1.5, one full-time, one half the time. And we will be expanding beyond just COVID because there are other diseases, other health disparities in the city that we need to know about, how they impact the city. So we will be doing research, we will be collecting data, and then we'll be analyzing those data and then share them with you. So we will be reaching out to you, pastors, to our churches, to know, to get your advice, to get some ideas from you, what we need, what your church may need, what you think the city needs to make it a healthier city. And in fact, let me add on this. I know some of you, I have approached you on this. We haven't finalized it with the mayor, but we would like to have a symposium where we discuss what we have learned on COVID, the lessons learned, and how to use those lessons. What we did well, what we did wrong, or where we failed, and how we apply those lessons moving forward. So we may not see, maybe most of us may not see another 100 years, but perhaps if our children
I think you will, Eno.
Am I preaching, Mayor?
God's grace, you will.
But at least we would have some knowledge, some scientific knowledge we can leave, we can pass on, so that they'll see what we did and how we did it. And if they need to change anything, so be it, they can change it, because science is a moving target. You learn something today, tomorrow it may not be the same, but you still have the basic. So we will reach out to you to get your input so that we can have a symposium, maybe a few hours, one day, to see what we learned, how we can apply what we've learned, and maybe drop or delete some of what we did not do well, and then apply how we can maybe do it better moving forward. Thank you so much.
Thank you, Doctor. Thank you, Doctor. Two things that
Of former mayor of New York, Bloomberg, and you hear a lot of Mayor Bloomberg, and then the other one graduate. Mayor, I have to say this. She graduated. The other one graduated from my alma mater, from Boston University School of Public Health.
not Boston College.
I'm sorry, Mayor.
Oh, my chest. So we're bringing on the best and the brightest, people that are going to help us long term. I interviewed both of these individuals. They speak multiple languages. Eno and his team interviewed them first. I wanted to meet them second. I committed to them that although it's funded from the state right now, if they do their job and they do it well, we're going to keep them. I have my budget tonight. The city council's budget is city's budget, yes. And the hearings for the city council are tonight, which I go, tomorrow night and Thursday night for the city's budget. So my goal is to make sure that when we attract talent here, professional talent, that are really bringing some value added, we want to keep those folks. So although they're subsidized, they're going to be paid from the state grant, we will keep them on as long as I'm mayor, because it's the right thing to do for our community. In terms of best practices, what did we do well, what didn't we do well, that's always valuable. Coming from a legal and a business background, I find a lot of value in data-driven stats, so we want to hear from you. Well, what worked well in your churches, what didn't work well? But today's purpose was a thank you, but also a Q&A. Of course, I wanted Dr. Rick and Dr. Eno to give us their updates, but really just wanted to kind of go around and talk about questions. I want to thank you, Eves, for always getting the message out. It's extremely important. You know, we are such a beautiful, diverse community, right? And we need to always showcase that in multiple languages. So if there's any social media avenue to get the message out, we need to do that. Radio, print ad, television, we need to continue to do that. So with that being said, I'm going to open it up, and if there's any questions or observations or comments, it'd be a great time to share those.
Question had to do with, the first question had to do with boosters.
Yes.
I do think that boosters are going to be just part of life now, boosters for COVID. And I think that how often they're given and what shots are given, we still don't know. I think it's likely that the next vaccine will be developed targeted towards whatever variant happens to be around. You know how the flu shot changes every year. Every year that you get a flu shot, it's a different shot because they manufacture a flu vaccine based on what the circulating strain of the virus is. And I think that's what's going to be happening with COVID, is that they'll be manufacturing a vaccine based on what the circulating strain of COVID is. And maybe sometimes they'll get it right, and maybe sometimes they won't. How often you'll have to get it, I don't know. I don't know if it'll be every 6 months, every year, but probably something like that would seem reasonable to me, is that'll happen. Now, I'm not sure I understood your question about going to the hospital and not doing it.
Let's say, for example, I'm coming from the Haitian community. Now I know we don't go to the hospital now. Let's say that if we have COVID, we said, okay, we can stay home, drink hot tea, and put all this other stuff in it, and we'll be fine. Which may not be the right procedure to do. And some of the people, it's for sure, they go to the doctor, they said, well, you can go home and just wait, things will be fine. So should those people go to the hospital anyway, or just stay home and things will be fine?
Well, I think you can always, if you have a doctor, or if you don't, if you go to the neighborhood health center, call your doctor to discuss it. What should I do? At the hospital, there are treatments that you can get. Basically, when I've stopped working in the ER a few months ago, but when I did see people in the hospital, you basically decide, how sick are you? Is there something that we can do for you now? Some treatment that we can give for you. Are you sick enough to need to be in the hospital? Are you sick enough to need to be in the intensive care unit? Now it's a little bit different, because if you're not sick enough to be in the hospital, but you're within the first 5 days of your illness, you can take these medicines like Paxlovid, and you can get that medication. You don't need to go to the hospital to get that. You can do that over the phone, through telehealth visit, through the state. You can just go to, I don't know the website, but it's masscovidtelehealth.com, and they'll hook you up right with a doctor right then and there. So you don't need to go to the hospital. But there are many treatments that are now available. Those both that can be used outside the hospital, like pill form, and those that can be used in the hospital, intravenous medications. So I would say, if you get COVID, you should be talking to a healthcare provider. And I would say, even if you call the Board of Health, right? Could the Board of Health direct you? Even calling the Board of Health, there are public health nurses who would at least be able to advise you. They might not be able to address your particular concern, but say, call your doctor, or it sounds like you're sick enough, maybe you need to go to the hospital, or here's how you would get in touch with the medication to get treatment, the Paxlovid treatment. So,
The other thing that's important, so at the height of COVID, Rick, and myself, and Steve Hook is our director of BEMA, Brockton Emergency Management. Monday, Wednesday, and Friday, 3 times a week at 1 o'clock, we had a hospitals call. Brockton Neighborhood Health Center, Good Samaritan Medical Center, Brockton Signature, the VA, High Point, and Father Bills. They'd all get on the call. We peeled it back, but we still do it every Monday at 1 o'clock. So we get the input from the hospitals. Rick and have contacts with the hospitals as well. So it's always best practice. If you have a primary care physician, you should definitely visit. If you want to go to a walk-in clinic, by all means. What our message is take care of your personal health, because your personal health has an impact on those that live with you. Your spouse, your children, legacy, your grandparents, whoever's with you. So, Dr. Y, I know you had a question. Sure.
Because I don't want to minimize the importance of what the mayor just said. It is true that 3 times a week we are on the phone with Brockton Hospital and Good Sam, and the VA, and the Neighborhood Health Center, and Father Bill's Mainspring, and High Point Treatment Center. I mean, I've been the chief of the emergency room at Brockton Hospital. I've been the chief of the emergency department at Good Samaritan. Throughout the history of these 2 hospitals, these are competing hospitals. They're trying to compete and get each other's patients. They don't play well in the sandbox together. Historically, they have been at each other's throats, okay? When COVID hit, the mayor was able to not only get them to play in the sandbox together, but week in and week out, sharing their data, discussing their data on the phone as recently as, when did we do it? Monday.
Yeah.
The 2 CEOs of both hospitals sitting there on a Zoom call with us. And bringing in the VA hospital as well, which is traditionally kind of just stay, they're in the federal world, not in the city world, but now they get on the call too. So
we humbly ask, if you test positive at home, please call. Very few people do that, very, very few. So we took it upon ourselves to then say, what's the next step? And that's unfortunately not a job that I would want to do, but Rick looks at the wastewater every night. We have a grant. Eno has secured it again to continue to do that. Again, the only difference is there are some neighboring communities that do tie into our sewer, so the number's a little skewed. But it really is a personal choice if you want to notify Board of Health, and unfortunately, most people are not. They're not.
So is that a concern for us being around?
I think it's a concern for every municipality, 351 in the Commonwealth. I just came back from the mayor's conference on the Cape for 2 days, and every mayor has the same concern, but every town manager does, every selectman does, every city council does. What my biggest thing is, we're at 70% fully vaccinated. My goal is 100%. It's never gonna happen, but that's my goal. So we have to continue to do that, I'll feel much better once that number goes up higher. But in terms of gateway communities in Massachusetts, we're #1. We have the highest percentage of people that took the shot, fully vaccinated. I agree with what Dr. Monaster said. Fully vaccinated is a misnomer now, but that's how we benchmark where we are with percentage.
Thank you.
May I? Mayor.
Sure.
So I want to echo what everyone here knows and has said. Thank you so very much for the work you are doing. And on behalf of those who have, well, I'm not on behalf because nobody asked me to say it, but I would say I think that everyone who got the grant is grateful. Initially, we thought only a handful of organizations will get it, but it spread so wide, and almost every nook and cranny is going to receive something and will make a little difference. So I really want to thank you for doing that. And I personally want to thank you for the work you've done. So some of you don't know this, we have a program at our church that is dealing with helping homeless in Brockton. And for the second time now, we have received 4,000 blankets from the federal government. And the mayor signed, I crafted a letter, and the mayor looked at it and signed it because they need the signature of an elected official. And he signed it, I sent it in within 3 weeks. I got a call, someone said the Congress has approved this and I'm to deliver 4,000 blankets to you. and 4,000 blankets came. I sent out the word, a lot of people volunteered, we got them off the truck, and they are stored. We have 4,000 blankets. I mean, they are going fast, but we have enough to see us through. The person who told me, if you need 1 million blankets, we'll send you 1 million blankets. So if you are in any ministry, I tell people to keep blankets in their cars. If you see a homeless person, you may not be able to give them money, but you can give them water, you can give them a granola bar, and you can give them a blanket. Yes. Now, it's simple, it's not expensive, and we can give you those things if you don't want to take out of your own pocket to do so. So I want to encourage anything, any program, any idea you have, if the city can help, whether it's a signature, especially when it's the government, they need somebody who is an elected official. The mayor can be very helpful in that. Other times there are things that come through the back door and you wouldn't hear about it. So during COVID, I got connected with the USDA, the Department of Agriculture, and they had this whole station in Weymouth where they delivered food, and they are all packaged, pre-cooked. Literally, you take a box, you get to your home, you can open a packet, put it in your microwave, and you have a meal. And it's 38 pounds, the fruits, vegetables, milk, cheese, meats, and all kinds of stuff. But it was COVID. I couldn't get volunteers anywhere. So I had to go rent a truck from U-Haul, drive to Weymouth, and load 100 boxes every single time. By the time I was done, I did not need to sign up at the gym. Because my calculation was that I put in over 10 tons of food. Brought them into Brockton, distributed them from people's homes. The homeless didn't use that because they don't cook. Right? So this is really to people's homes, and we have open opportunities for all kinds of people. So there are opportunities very often. We may not know, so if your city the city hears something, there are organizations that can go actually do the job. It's not just money that we want from your office. We want to be able to have access to information and other resources that we can now use to apply to support the city. Absolutely. I will close with this one question, and I have asked you this question every single time. What policy, not really policy, what action is the city pursuing to deal with the homeless in the city? We've worked very well closely with you. You've been very supportive. I was part of the task force. But I know that even with what that we're building now at Broadway, the homelessness issue in Brockton is really became worse after COVID.
That's right.
Many people ended up on the streets, and then they had a place to stay because of the moratorium on evictions.
Yes.
And then when that expired, many people came out of everywhere. And we depleted every money we have. We've given out almost every food we have. There's only so many blankets you can give out to somebody who needs a home. I don't know what can be done for people to actually have a place to just put their head in the morning. Our church is open.
Yeah,
So Monday through Saturday, the homeless can come in the morning and stay till evening. So they have a safe place. They can read a newspaper, watch a TV, read a book, have a meal, and then they'll leave they can sleep there. That's the only thing that they can do. But as we see those numbers, we're worried, will there be enough for us? Is there going to be a time when we would say we have done our job, we don't need to open anymore? Whether that will ever happen.
No, thank you. So, listen, we're all human beings, right? And we were all brought up with the understanding that you should have a roof over your head. And people on the street, there's many reasons why they're there, right? Alcohol, drugs, mental health. Maybe they lost a house in the foreclosure epidemic, right? So we have to have a compassionate approach. So one thing that I did as mayor when I became the mayor was to work with John Yazinski at Father Bill's Mainspring, Pastor Wyatt, Dr. Wyatt, Pastor Roberto as well, to try to figure out how we can brainstorm to help people. We knew that COVID was going to run rampant in the homeless population, right? Because at night at Father Bill's, it's a confined area. So I worked with the state, I worked with Eno, I worked with Rick to get tents. Governor Baker, I called Charlie myself, and we got tents so we could actually spread out the population and limit COVID. We also worked with Sue Jost and leadership team, Dr. Chelly at Neighborhood Health Center. One thing I'm extremely proud to say is that as mayor, I also fully support, as does Congressman Lynch and Senator Markey, who I've called and I've met with. I flew to DC and met with Ed and Stephen. And what I said was, we need to figure out how we do wraparound services, how we do a campus setting for the folks, right? A lot of our folks have mental issues. We need to address that. COVID has enhanced that for our young and our old. People in the houses and on the street. We have to come up with services. So Father Bill's, there's a law, it's called MCTV, and they're allowed to trump a city. So there's a piece of vacant land on Manley Street that abuts the VA hospital. I wanted to acquire it for the city. I wanted to put our DPW there, take them off of Montauk Road, put them there closer to 24. It made sense. MCTV says, no, if someone provides homeless services, I support it 1,000%. So Father Bill's Mainspring will be moving to Manley Street. It will be a campus setting. It will be for homeless families, homeless populations, veterans as well, which abut again the VA. It will be educational, ESL, and wraparound services with a dedication to mental health. It's not going to happen tomorrow, but it's going to happen. We already have the money in place. I've committed some ARPA money, federal money that will be coming in as well. So we will, in the meantime, try to figure out collaboratively how we can help. I have a director of social services in my office named Jasmine Bradshire. You may remember the name Corin Capiello. Corin used to do that job under Mayor Bill and Mayor Moses. She works for the schools now. Jasmine used to work at Father Bill's. She also is a product of Brockton High School. Her dad just passed. He was a firefighter, so they're entrenched in Brockton. She actually right now is up at DW, walking in the woods, talking to folks that have a campment up there, working to make sure we can help them. So homelessness is chronic, but as Christians all around this table and our Jewish brethren, we know that we have to take care of other humans. So we will do it. I want to give a shout out to Dr. Wyatt, who's always opened his church, giving food and comfort, support and love. We'll continue to do that. And as mayor, that's my charge. We need to do that. So thank you.
I'm the director of a program that we're trying to roll out at the end of July.
Okay.
And you spoke about the mental health issues with the youth.
Yes.
Unfortunately, I've had a granddaughter who's been hospitalized 9 times because of depression, anxiety, and suicidal thoughts. This is something that I have seen from this experience. Kids of the age of 8 years old at Brockton Hospital Emergency Room, sitting there to find a place where they can be helped. So what we are trying to do by the end of July is compile a program.
So myself and Superintendent Thomas and the 7 school committee members, we've put money in the budget this year, which will be voted on this week by the city council. The school committee already voted on it. We can't use the word earmark anymore, but we set aside money for mental health, education, resources, assistance. That's in the Brockton Public Schools. I've had conversations with the other schools as well. Cardinal Spellman, Southeastern Regional, Seventh-day Adventist, Trinity Catholic Academy, New Heights Charter School, because we need to take care of our children.
Yeah, so what we're rolling out at the end of December,
July.
I'm sorry, is a program where we invite the youth from
Thank you,
10
Rick.
to
Thank you.
16, from 10 years old to 16 years old, and we're going to be doing it at the space at our church. And what we're doing is developing groups for these youth where they can have a space that they can feel confident, positive, self-worth, and we're doing this through activities and outward trips, but also
with my office, and we'll get it
yes,
out
we have a brochure,
Thank you.
and it's called the GAP program, and it's mainly a lot for the youth and girls, meaning empowerment, young men that need empowerment, and we are doing self-achievement cultural works with them, where I have had so much experience with this and dealing with my granddaughter and the psychiatrist that has also been informing me and training me so that I can be a counselor and a mentor to these youth. And we're rolling that at 362 Montello Street at the end of July. I'll send you the brochure so that way you can have that as
So
well.
I have 2 children. I coach basketball, soccer, baseball. The kids that I know before COVID are not the kids that are right now, right? Everybody's changed.
Yeah.
Financially, emotionally, physically, mentally, it's changed. So any resources that we can partner on, we have to help. They're the next generation. The boys and girls, next generation. We
Yes.
have to help them.